Hi, it's Mrs. Hanson, your instructor. I just want to reiterate something I said in my mini lecture for Chapter 14, and it's about the importance of asking for help when we know we need help. No matter what type of therapy you might end up receiving from your therapist, the important thing is that you're asking for help and you sincerely want to give it your all. And that means opening up, digging deep, being as honest as you possibly can. The hardest thing of all is to be honest with ourselves. Uh, we have to break through denial in many cases. We have to quit thinking like a victim, and we need to work with our therapist as hard as we possibly can. If you need psychotropic medication, your therapist will probably refer you to a psychiatrist who can prescribe. Only medical doctors can prescribe medications like antidepressants or anti-anxiety medications. And it's very, very important that you be evaluated by a medical doctor, and psychiatrists are the specialists in this area. I know there's a big stigma about psychiatry, but if you had a broken leg, you would not go to an asthma doctor. You would go to an orthopedic doctor. And if you had, a pregnancy, you wouldn't go to an orthopedic doctor. You'd go to a an obstetrical doctor, obstetrician. Psychiatrists are specialists. This is what they do. They understand how the medications work differently for different aged people, different genders, different stages of life. Everybody's metabolism is a little bit different. They need to take a really good history of your sleep, your diet, and all kinds of things so that they will figure out what the best medication for you is. Never, never, never take another person's medication. Ever. It wasn't prescribed for you. It might not be the right medication for you. And by the way, because there are many different medications, it sometimes is a trial and error process to get the right one for that individual. For instance, an antidepressant medication may work beautifully for me, but it might not work so well for a 20-year-old male. Why? Because we have totally different physiology. My brain and my body is unique to my age group and my gender, and so you cannot just take somebody else's medication. I just want to make that clear. And there shouldn't be a stigma if you need medication. I mean, it's like a diabetic takes insulin because they need it to correct an imbalance in the body. And if you think of severe chronic major depression as an imbalance in the brain chemistry of serotonin and sometimes norepinephrine, then certainly you wouldn't put down a diabetic for taking insulin. Let's don't put down people who are suffering from major depression and anxiety by their medications. Let's don't put them down for taking the medications. They need it. Now, if you can get better without medication, isn't that great? You can avoid taking medications and get better with the restructuring of your thoughts and your feelings. Cognitive therapy can help you straighten out your thought patterns. Almost everybody needs that at some point. Quit thinking like a victim, quit thinking like a narcissist, quit thinking pessimistically, quit thinking that you're owed something, quit thinking about the past with resentment and anger, all kinds of things like that. Free therapy is available for COS students, even those of you who are strictly online, at the COS Health Center. Over the breaks, they're not available, but during the semesters, they are here for you, and it's free, and it would cost about $150 an hour in private therapy. I have a list of therapists that I can refer, if you need a referral for someone in your family or for you, I can give you a referral to some great therapists that are in private practice. Insurance may or may not cover some or all. It depends on your insurance plan. let's all work on being our own best therapists by paying attention to our signs of trouble and struggle and knowing when to reach out and ask for help when we need it. Okay, good luck with chapter 15.